The Rebound Buffalo is working to try and get some answers for you about your vaccination questions. All this week here on 7 Eyewitness News at 6 a.m. and 6 p.m. You'll be hearing directly from the leaders of 6 county health departments about the vaccine rollout. Our 7 Eyewitness News reporter Olivia Proya brought them all together for a virtual roundtable to discuss the challenge right now and what's going to happen in the future. Tonight, we're taking you in depth, looking at some of the vaccination struggles for rural communities and the need for more resources. Again, here's 7 Eyewitness News reporter Olivia Proya.
Public health directors in western New York's rural counties say their populations were disadvantaged even before the COVID-19 pandemic hit.
Being rural is its own disparity. I mean, we have our challenges in the rural areas, specifically with access to care. I mean, Orleans County is the worst in the state. The health rankings are just coming out now again. Our provider ratio to population is worse than third world countries.
How do you deal with the lack of broadband and internet access?
I think that's $1 million question. We only have a $100 answer for you. That basically, without a broadband, we really found ourselves stagnant in a rural community as we moved to telehealth.
They say these issues have only worsened throughout the pandemic, especially when it came to securing vaccine appointments.
And Chicago has a higher population of elderly and a higher population of disabled than anywhere else. So I think we've had challenges, as Paul was saying, with technology and being able to actually sign up and get appointments.
So we saw the infrastructure of a community lacking, not only the infrastructure of public health.
They say the only way to fix this is more resources.
It's all about funding and making sure that the rural communities have an equitable distribution of those resources within their communities in order to deal with some of the things that these rural communities are dealing with on a day-to-day basis.
But when it came time for additional pandemic help from the federal government, they say rural counties were excluded.
As Dr. Bursey mentioned, they received direct funding from the feds and the CARES funding. Hundreds of millions of dollars coming into Erie and Monroe and Onondaga and Albany and downstate. The rural counties received none of that. And, you know, we're expected, just like they are, to be responsive to the need of our residents.
So all 3 public health directors say they will continue to advocate for more resources for their counties.
Rural health and rural residents, rural counties matter. And we need to make sure we all have our voice heard and that ultimately the resources and allocations come our way so that we can meet the needs of our residents.
Olivia Proya, 7 Eyewitness News.